So it's a rapid review of CNS central nervous system. So first one is seizure and epilepsy. Seizures can be classified into generalized and partial types. Generalized seizures can be tag CM. So tag CM stands for T for tonic seizure, A is absence and atonic, G is generalized tonic-clonic seizure, C is clonic and M is myoclonic. So these are all types of generalized seizures. Generalized seizures are tag CM. Partial seizures, these are simple partial seizure. Okay, there are simple partial and complex partial seizures. Complex partial seizure occurs in case of temporal lobe epilepsy, which is nothing but mesial temporal sclerosis. Carbamazepine is the drug of choice for partial seizure. CBZ for partial seizure. Partial seizures of two types, simple and complex. Complex occurs in temporal lobe epilepsy. Febrile seizure. So febrile convulsions are by and large the most common type of seizures occurring during childhood, early childhood. So the age of presentation is going to be 6 months to 5 years. Febrile seizure is defined as seizures which occur during fever. So there is fever and there is seizure. It's called a febrile seizure. The convulsions are not related to the degree of rise of temperature, but again, if it's going to be frequent if the temperature rises abruptly above 39 degrees Celsius. Spontaneous remission occurs with no post-ictal neurological deficit and EEG changes few days after the seizure is normal. Recurrent febrile seizures occur in 30 to 50% of the cases, and more than 90% of the febrile seizures are generalized. Acute respiratory illness are most commonly associated with febrile seizures. Spontaneous remission occurs with no post-ictal neurological deficit. Why? Why is there spontaneous remission? Okay, it occurs because of the fever, so you're going to control the fever, it's going to get controlled. The seizures, by and large, is no problem. There's a post-ictal neurological deficit is not there. EEG changes to normal within a few days. Okay. Yeah. So like till then, it's going to be a bit abnormal, so it's all fine. A recurrent febrile seizure occurs in 30 to 50% of the cases. More than 90% of the febrile seizures are generalized, which means tag CM. One of the tag CM is going to be present. Acute respiratory illness are most commonly associated with febrile seizures because we know why. Because like acute respiratory illness is the most common cause of fever, so fever is going to cause seizure. So like acute respiratory illness is going to cause seizure technically. Okay. Clinical features. These are the following types of febrile convulsions: simple, benign, complex, atypical. Okay, simple benign is more common. It lasts for less than 10 minutes and is generalized in nature. There's usually single seizure in the same day. No post-ictal neurological deficit occurs. So this is about the simple seizure. Simple benign seizure. Okay, so it's common. It's okay, fine. Complex seizure it lasts more than 50 minutes and focal in nature. More than one seizure occurs in the same day. So there are totally three distinct features of febrile seizures. Okay. So type simple and complex. Simple it's more common, complex is less common. Simple lasts for less than 10 minutes, complex lasts for more than 15 minutes. Simple is mostly generalized variety, complex is mostly low focal variety. And then there's only a single seizure in the same day in case of simple seizure or a benign seizure. If it's going to be complex or atypical, multiple seizures occur on the same day. Risk factors for recurrence of febrile seizures are positive family history, atypical complex seizure, focal features, early onset less than 1 year, more than one seizure in the same day, neurodevelopment retardation, developmental delay. Children with febrile convulsions are at increased risk of developing epilepsy in the future. It may occur in 2 to 7% of the cases. So these are all the risk factors for recurrence of febrile seizure. Actually, 6 risk factors are there. So family history, குடும்பத்துல யாருக்குன்னா இருந்துச்சுன்னா, you're going to get it again. If it's going to be early onset, okay, so the key number is 1, okay? So like less than 1 year of age, early onset naka, அவங்களுக்கு திரும்பி recurrence நிறைய chance இருக்கு. And 1 is the God number, so more than one seizure in the same day, the person is going to get seizure again. Atypical seizure naka, they're going to get again. Atypical nakaவே focal தானே, so focal nala they're going to get. Neurodevelopmental retardation, developmental delay is also okay associated with it. Children with febrile convulsions are increased risk of developing epilepsy in the future. It occurs in 2 to 7% of the cases. Treatment prompt reduction of the temperature by giving hydrotherapy as sponging and antipyretic drugs. Paracetamol, ibuprofen is the most important. Measure the seizure lasts for more than 5 minutes. Diazepam, rectal or IV is the anticonvulsant of choice. Phenobarbital alternative. For prophylaxis, prevention of recurrence of febrile seizure, intermittent prophylaxis is used. No drug of choice, oral or rectal diazepam, other benzodiazepine. Failed intermittent prophylaxis, continuous prophylaxis, sodium valproate and phenobarbital. Carbamazepine and phenytoin are ineffective prophylaxis. Measures to lower the temperature like sponging and antipyretics have no